My name is Dr. Don Rohl. I'm an orthopedic spine surgeon here at OrthoNeuro. I specialize in conditions of the spine. Generally do mostly reconstruction work. We'll do microdiscectomies, anterior fusions, posterior fusions, that sort of condition. In general though, I just take care of people with spinal conditions. A lot of times we don't end up operating, which is fine. Our job here is to try and help people. So what pushed me to do spine surgery is when I was finishing up my residency in orthopedics, we didn't get a lot of spine. And it was one of the things I thought was not well understood as far as how do you treat people? How do we help them? You know, you can only do so much anti-inflammatories, physical therapy before there's times you have to do something physically to help. And I used to do construction when I was younger. And so reconstructing the spine kind of made sense. In orthopedics in general made sense. And so that's where I thought, you know, doing a fellowship in spine would teach me what I could do to try and help somebody. And when I was finishing up, they were coming out with artificial discs. And I thought that would be something that would be really beneficial for patients. So far, I'm not convinced that we know enough there that that's it. But from doing these for 20 years, you know, it's come a long way in our ability to help people and trying to maintain their quality of life or improve it. So I went to college at Otterbein University in Westerville, Ohio, here in Central Ohio, and then I went down to Ohio University and did my medical school training down there. Then I went up to Cleveland and did my residency and internship. Then I came back to Columbus and I did my fellowship here at OrthoNeuro with Dr. Seibert, Dr. Todd, and some of his other partners. My passion with this field is helping people. You know, there's no greater joy than having somebody come in with a big smile on their face and you can tell right away that they've got their life back. That's what drives me. There's nothing better than that. You know, I can remember doing OBGYN and delivering babies. I thought that was pretty cool, right? There's nothing better than somebody getting a baby. But this is right there. When you can help somebody get their life back, be out of misery, that's pretty rewarding. The uniqueness of OrthoNeuro is mindsets are pretty similar. The ability to help people is what we're looking for. And we tend to be conservative when it's appropriate and aggressive when it's appropriate. And having all the subspecialties there, for the most part, allows us to take care of things when there's overlap. Like we'll see somebody with a neck problem, but really it ends up being the shoulder. Or we see somebody with a low back problem, it really ends up being a hip. Well, we can laterally move to the hip replacement guy or the shoulder guy and vice versa, so we can take care of a lot of the crossover stuff. But the mindset is similar. The patient comes first. And if you treat people that way, kind of how you want to be treated or your family treated, then you're going to end up pretty well. So my goals for the future are really to continue to try and achieve the best possible outcome every single day. I don't know that my goal will ever change. It's the same thing every day I come in. I want to give people a good service, try and get them to where they want to be. And so I don't know any reason to change that. You know, we continue to look at new innovation, but I'm pretty slow to adapt, you know, new cutting edge technology. I'll let somebody else experiment. I know what I'm comfortable with. I know where I get my outcomes and how to maintain those. And so I'm not one that tends to change that.